is Gayle Berry. I am the founder of Blossom and Berry, which is a global teacher training company helping to teach students to become infant massage and yoga teachers and share the benefits of nurturing touch, massage and yoga with parents across the world. And I've come on today to make this video for any of you who have a baby who is currently suffering from colic. Now, there's two reasons for doing that. One is because I have a huge amount of expertise in working with babies working with parents with babies who are colicky and who have constipation and wind. So I'd like to share that knowledge with you, but also because I have had a colicky baby myself, so I totally know and understand how you feel right now. I would imagine that you are feeling overwhelmed by having a baby that cries consistently, disempowered because no matter what you do, nothing seems to work. You're probably overwhelmed because you're Googling things, you're getting advice, you're reading books, you're going from here to there with loads of different pieces of information, and in all of that you're kind of maybe forgetting your instincts and what even feels right for you. So I know that feeling. And then on top of that, obviously if your baby is colicky, you might not be getting much rest or sleep, and you know you're kind of spending a lot of time obsessing around what's causing this for your baby, how can you help your baby, and that whole experience can be really draining and negative. So I get it, I'm with you, I've been there, and I've also seen so many other parents with feel like this too. So it's not you. That's the first thing I want to say, is what's happening with your baby is not because you are a bad mother or a bad parent or something that you're doing or the birth you had or the pregnancy you had. Colic kind of comes from nowhere in particular. There isn't even any scientific studies or research that really help us understand where colic comes, why it comes, what aggravates it, and even what we can do to help with it. So it's not you, and I just want you to know, I need you to know that. But there are things that you can do, because obviously you are your baby's carer, you are your baby's first teacher, and when your baby's in pain, you need to make sure that your baby knows that they're being heard, that they can be held, and that you understand that they have these needs that you can help them with. And so I want you to know that we're going to look at some techniques today, one technique in particular which can really help to soothe and calm your baby. Okay, now just before we do that, as I mentioned, nobody really knows what colic causes colic. There's loads of different explanations, from overstimulated nervous system, undeveloped digestive system, from diet, from what you eat in terms of breastfeeding, in terms of what kind of birth you've had, if your baby was born with forceps or a ventouse. There's so many different theories, and there isn't really any concrete evidence that helps us to understand what causes colic. A colicky baby is normally described as a baby that cries for between 4 to 6 hours every day for a period of 14 days. So that is a prolonged period of crying. So if you have a baby that's a little bit fussy, and maybe fussy particularly around meals, they might just be suffering from trapped wind, or they're a bit gassy. But if you find that they are crying consistently and persistently for day after day after day, then that's more likely to be colic. Other symptoms that come alongside colic include drawing your legs up towards your tummy. Sometimes babies can go a little bit blue around the lips. They have a lot of stress and tension in the belly. Their breathing can be quite irregular, and of course they cry a lot because they're in a lot of discomfort, and they need to tell us, because that's how they're hoping that they're going to be able to you know, have their needs met and to be able to cope with this uncomfortable feeling inside their body. So again, crying is just baby's way of communicating. Please, I know it's hard, but don't take it personally. It's not because your baby's an unhappy or grumpy baby, or because you're doing something wrong, or even that your baby doesn't like you, or they're going to be a difficult child. It's all of these things are to do with basically baby's body systems being very immature at birth, and that we have to give them the space and we have to be patient to allow them to develop and grow. Okay, so let's have a look at a technique that you can use straight away to help to soothe and calm your baby. It's called Tiger in the Tree. And it's a pose that I've used with my own children when they've been unsettled and colicky, and also with hundreds of other parents in my baby massage classes to help to soothe and calm their babies. So I'm going to introduce you to my doll Max. So this is my baby. He doesn't cry and he's very well behaved, but he's a perfect baby doll to demonstrate the pose for you. So what we're going to do is place baby into the crook of our arm here, so their head is well supported. We're going to place one hand on their belly like this and the other hand over the top like that, and then from here what we can do is very gently bounce baby or rock baby, and that's going to give them that soothing action of movement, which they would have experienced in the womb, and they will associate with being safe and secure and having everything they need, perfect temperature, food on tap, having a massage the whole time by the inside of your womb. So that's when they were in their perfect kind of relaxed state. So this pose is going to help to bring some of that into your baby's world now they've been born. So the pressure on the tummy is really interesting here, because there's a nerve in your body and in your baby's body called the vagus nerve, and it's the nerve that is responsible for all of the relaxation responses in your body. It connects into something called the parasympathetic nervous system, and when it's gently stimulated it produces the relaxation responses like lowering your heart rate, lowering your blood pressure, boosting your immune system, helping with digestion and promoting rest. So when we place our hand on our baby's belly like this or put pressure on the tummy, it very gently helps to stimulate the vagus nerve and can help your baby to feel more relaxed. Of course, on top of that, on a basic level, holding your baby's tummy in an area where it's uncomfortable also communicates to your baby that you understand this is where the pain is coming from. So it instantly helps to calm and relax him from that point of view. Also, if you were able to add in a little bit of humming whilst you're doing this, or a little bit of back rubbing, that will also get the oxytocin flowing. So oxytocin is a hormone that helps to reduce stress hormones in the body. It helps to promote feelings of relaxation, so that will also help with the sensations of pain, or if baby is getting stressed and anxious, so it's going to really help as well. So that is a really easy position to do, Tiger in the Tree. It's one that I've used, like I said, with many babies. And you can also, if you want to, add some patting that replicates the sound of the heartbeat, which again will be a familiar and relaxing sensation for baby. And yeah, just kind of maybe pace around to get that sense of movement in, and just, you know, tune in with your baby. Just try to relax your own body so that baby feels your body is soft and welcoming, and not that you're tense as well. And take turns with somebody else if you have a partner or a friend or a family member, just so that, you know, you don't get that sensation of being overwhelmed. Okay, I'm going to pop baby down like that. So yeah, so this technique, as simple as it seems, is definitely worth trying. And remember, with babies as well, it's about being consistent. It's about regularly practicing these poses. You're not just going to pick your baby up, put them in this pose, and the colic is going to disappear. That isn't how it works. Really, with babies, when they're born, the nervous system is immature, the circulatory system is immature, the digestive system is immature. We have to be there to nurture our babies, to support them, particularly in the first 12 weeks of life, to make that transition from the womb to the world when their senses are still developing. And quite frankly, can you imagine how overwhelming everything must be for them? So yeah, so try to be there for your baby, try to look after yourself. Remember that this is something that you're going through with your baby. It's not your fault, it's not your baby's fault. It will pass, and studies show around 12 weeks it does tend to subside. So just hang on in there. try and use this technique. Have a look at some of our other videos, and I will also be sharing some other techniques too. And if you want any more information about baby massage, you can visit www.blossomandberry.com, and you can also find our specialist teachers that work with colicky babies there, using something called our Soothe, Settle and Sleep program that can help you to cope with your baby's colic naturally and gently. Okay, thanks so much for watching, and yeah, do subscribe if you would like any other videos around early baby care using gentle parenting and nurturing touch massage and yoga. Have a great day.